Hi, everyone. I'm Gigi Kanyanga-Fernandez, NPN's current board president, and welcome. This is NICUnity. And as you know, some of you may know, NICUnity is made possible by the generous support of KIESI USA and its NICU Parent Network's all-encompassing educational initiative to really foster a culture of belonging for all members of our community. And our monthly schedule of NICUnity offerings include discussions, our leadership lounges, and special health topic webinars. And it's really designed to bring together NICU parent leaders, adult former NICU patients, healthcare partners, and maternal-infant health stakeholders for candid discussions about diverse experiences in the NICU and beyond. And we're doing this because we really want to shine a light on those who are often marginalized, silenced, and underestimated within our communities. And we are thrilled to be able to provide this platform for some really raw and authentic conversations. So thank you for joining us as we embark on this journey of learning, growth, and unity together. And that as we work together to build a stronger and more inclusive NICU community, one conversation at a time. So today we're going to continue on our discussion that we actually had in May. Can't believe it's been May. That we're delving into the barriers that are often experienced by mothers in accessing mental health services. And we want to really explore strategies for advocating the mental health and empowering NICU mothers. And we spoke back in May with Dr. Celeste Poe, and we are so excited to welcome her back today to discuss how improving access to maternal mental health services is really a community issue. And we must ensure efforts are aimed towards the promotion and prevention of perinatal mental health disorders across all settings. And we also need to ensure that these strategies are really designed for advocating for maternal mental health, that when we do these strategies, that we consider the structural and social barriers that exist so that we have equity across maternal mental health. And so this is such an important discussion that we asked Dr. Celeste Poe to come back and share with us. And it's really for anyone who works in maternal mental health and really is vital to our understanding of how we can truly support families. So I'm delighted also to welcome my co-host, Kira Sorrells, who is an executive director of NPN. And Kira is feeling unwell today, but she's still present. And so she is going to be sort of my silent but mighty co-host. And we'll make sure that all the tech things are sorted, that the comments are monitored, and of course, that I stay on track. So let me just, for those of you who were not with us before and don't know Dr. Celeste Poe, I will just let you know that she is amazing. She is a licensed clinical psychologist certified in perinatal mental health. She's a clinical instructor and director of the NICU psychology program at Lucille Packard Children's Hospital in California. In her role, Dr. Poe provides psychological support to parents of infants hospitalized in the NICU and throughout the hospital. So welcome again, Celeste, and thank you.
I'm really happy to be back. Thank you for the invitation.
Thank you for accepting it. So in our first discussion, we began to uncover the effects of maternal mental health on hospitalized infants, how to support families, and then the importance of mental health support, not just in the NICU, but beyond the discharge as well. And one of the things that sort of came out of that discussion that we touched on lightly was on the existing barriers to mental health care. And today with you, we really want to begin to delve a little bit deeper within that and begin to peel back the layers on this issue. So with that, I guess one of the first questions we were thinking about was, what do we mean when we say access to care? What does that really mean?
I think this is such a great question because we hear this phrase access to care a lot. We hear barriers to accessing care, that phrase, but
Mm,
what does it actually mean, I think is really important. And the way that I look at it is that there are resources available to parents
mhm.
and we want them to be able to reach those resources, but we
Yeah.
also want them to be able to benefit from them. So it's
Mm,
getting the parent into the therapy room or to the psychiatrist, whatever that is, and then also making sure that whatever that care is, that it is effective for that particular parent. Which, I mean, I think that there's a lot of steps that go into that and thinking
yeah.
about that journey
Yeah.
from a parent having a mental health need to them
Mhm,
actually benefiting. It sounds a lot
mhm.
more simple than it actually is, but as
Right.
we talked a little bit about last time, it
Mhm.
really does start with awareness. So the
Yeah.
parent
Mhm.
even understanding that there is something wrong, or someone identifying for them, whether that's through screening or them talking with a provider who recognizes, I think that you could use some support right now.
Mhm,
That's a huge
mhm,
step in and of itself. And then
mhm,
ensuring that a provider helps put in a referral or gives that parent the knowledge of what
mhm,
resources are even available to them.
mhm.
And then, of course, the resources need to be available. We know that unfortunately there's a lot of wait lists and a lot
Yeah.
of difficulties with actually accessing what resources are available.
Mhm.
A parent needs to be able to afford whatever that resource is.
Mm. Yeah.
It needs to be located in a place that they can access it, whether that's through telehealth or
Mhm,
in-person services. And then, of course, I think when I think about a parent being able to benefit from services,
mhm, mhm.
this is the piece that I think that we ignore a little bit or that doesn't get talked about as much. But it isn't enough just that the service is available and that we've given the parent the phone number. We really need to be thinking about, is the care a good quality care? Have these people been trained in perinatal mental health, maternal mental health? Are they culturally responsive? Are we
Mhm,
thinking about
mhm,
language needs in terms of the preferred language of that parent? Is that available to them?
mhm,
Is this provider sensitive to issues related to race,
mhm.
racism, legal status, ability status? And then, of
Right.
course, for our families who identify as LGBTQIA+,
Mhm,
are these services safe and affirming for their
mhm,
families as well?
mhm.
So it gets really, really nuanced when we're talking about
Yeah.
access to care. It's not simply giving someone a phone number that they can reach out to.
Right, right. I mean, that's is so much within what you've just said, and I really appreciate when you talked about making sure that it's beneficial, and that requires a lot of stuff that's happening beforehand, before the end product, I guess, if you like, occurs. And I'm so happy when you said about safety, because that was when you were talking, I was thinking, wow, before you even get there, you need to feel safe
Mhm.
to even go there. I mean, to even go and say yes, hold my hand up and say, yes, I need help, and feel safe enough that whoever you're going to be getting help from will protect you within that
Yeah,
space.
yeah.
Um, and I guess when you're thinking about that, then what are some of the sort of things we need to consider before we even begin? You talked about awareness, but are there any were there any maybe one or two things that we need to be really aware of to move from awareness to that safety bit
Mm.
before we start going to the actually offering the services?
Yeah, I mean, I think that when I'm talking about awareness, I'm talking about the parents' awareness. And
Yeah.
so
Mhm.
I think if we want to increase their awareness, so a lot of efforts that we see right now are related to screening,
Mhm.
training providers so that they know how to talk to parents if they recognize that there is a mental health need. But a
Yeah.
big training and even thinking about screening process is how safe the parent feels to not only honestly disclose how they're doing, but
Mhm.
also it's not enough to tell a parent, you know what, you scored above threshold on the Edinburgh Postnatal Depression Scale. This means that you're probably at risk of experiencing postpartum depression. So we're going to give you these phone numbers, because if a parent does not even feel safe with the person who did the screening, they're less likely to then go ahead and follow the referral pathway. So I think that beginning meeting with a parent and making sure that they know that it is not necessarily normal, but common to experience some of the difficulties that they're experieing, and that they can get the support that they need, that this doesn't mean that their child is going to be taken away, or, you know, really creating a space that is uniquely tailored and sensitive to the mom that you have in front of you, to ensure that she is going to, you know, reach that next step of actually utilizing the referral that you place.
Right. There's something so powerful in what you said about it's not normal, but it's common. And being able to be told that, so that you don't feel alone, you know, because when you're in that space, you're feeling like I'm the only one that's having these thoughts or having these feelings, and sort of to have that come from a person that really means it. And like you said, it's very important that the person offering the service, offering the survey is sensitive as well. So yes. And I guess I'm thinking too with that was, why specifically do you feel sort of lack of access to mental health care is so prominent now?
Yeah, I mean, I think ironically it is so prominent, and it's probably gotten a lot better than what it used to be, but you know, we're still very far behind. I think if you think about just 10 years ago, how different it is now in terms of the way that people talk about going to therapy or mental health. It is so different in terms of our ability to recognize that this is a big piece of well-being, and that it is just as important as physical health. However, I think as much as we kind of intellectually recognize that, I think our systems, our funding sources, all of that is still not in place to catch up with the actual need that we see in maternal mental health. So in terms of the availability of providers, the funding that's going into training more providers, making this more accessible, it's not there in the way that we need it yet, unfortunately. But I do see that there's a lot of movement and a lot of discussion and energy around making this more accessible, particularly maternal mental health. And so it makes me excited. And also we have a lot of work to do, for sure.
Right. And I guess, do you feel like within that, sort of recognizing that, yes, we've done some things, but we still have a way to go. When you're talking about resources and infrastructure and those kinds of things, do you feel like it's a sort of a grassroots effort for the people on the ground who are actually doing the work? Is their responsibility to sort of raise the awareness, or do you think it's a political thing, or is it's just a societal issue, or is a combination of all of the above?
I mean, definitely a combination of all the above. As you remember from last time, I said that it's a community issue, and I really think it requires everyone. One of the reasons that I recognize, just specializing in infant mental health and perinatal mental health, is that we know in the field that preventive mental health is essential. There's been a lot of research that shows that the more funding and resources we pour into maternal mental health during the perinatal period, that we not only have better outcomes for parents and children, but that we save a lot of money, which you would think that a lot of the people in leadership and in politics would be paying attention to. And yet we don't see the funding and resources matching what the research shows. And so I think a big piece of this is that we need to keep talking about and pointing to the need for more preventive mental health services. But I think that that's a big reason why we see such a lack of access and care in this area.
Right. It sounds like what you're saying is really that being more proactive than reactive, you know, so we're not putting a bandage on it, and recognizing, like you said, the long-term financial benefit as well as society's benefit.
Yeah. Exactly.
Yes. How do you feel access sort of feeds into equity?
Yeah. Well, I think that they are so similar in terms of, the meaning behind them and what we're trying to convey in terms
Mm,
of the need with families within the US and worldwide. When I think of equity and mental health specifically, I think of this idea or this ideal that everyone, every parent, every family has the right to optimize their mental health and their mental well-being,
mm, mm,
regardless of any of the factors that may create barriers to them doing so, so that they have equal opportunity, regardless of the amount of resources or barriers that their particular family has. So when we're talking about access, these barriers that exist to access, or we have decreased access for a particular family to reach the services that they need, we limit their opportunity to promote their mental health and
mm,
our opportunity to promote mental health equity across the board.
mhm,
So if we focus our efforts to increase access and address some of these barriers that exist,
mhm,
the more likely we will see equity across different families with different backgrounds, with different
mhm,
access to resources, because
mhm,
our mental health care system is sensitive to and responsive to the fact that there are inequities in terms of resources
mhm.
and people's ability to access the support.
Yeah, yeah. And I guess it kind of goes back to what you said earlier about making sure you provide something that's meaningful.
Mhm,
And so if there's if a service is provided, but it's not attractive to
mhm,
the person who needs it, because of the way it's presented, it may be the language, maybe, maybe the timing, because it's maybe too late or whatever it is. So I think it's just the more you're speaking, makes me even realize, just like you talked about earlier, all the nuances, how important it is to take time through
mhm.
those nuances to get it right,
Yeah.
and to get it right for every part of that community. And it may look different depending on who the audience is,
Mhm,
and that's okay. And so I think it's something about that in individuality, intersectionality, and also commonality, and how
mhm.
they all, work combined together and work together in order to, in order for it to be truly equitable access.
Yeah, yeah.
Yeah.
And I think
Wow.
one of the difficulties to build off of that is when we have these big institutions with a
Mm,
lot of parents and moms that need support with very little resources. Unfortunately, what that tends to result in is a one size fits all approach, because
yes.
we
Yes.
limit our ability as providers to provide
Mhm,
that more sensitive, um, nuanced, responsive care. And
mhm,
so I think that it is sort of like a double-edged sword and a cycle that just kind of feeds off of itself. So I think
mhm,
the more that we're able to increase providers, people who are trained in perinatal mental health, then we
mhm.
have the ability to meet the needs of the unique needs of all of the families that we see.
Right. And I guess it's something about too, sort of it's a culture shift in the way we think about healthcare. Because my background is I have a medical, clinical background, and but from the physical sort of side of it, and that whole concept of we are, healthcare is I'm gonna fix you because you're broken sort of thing, concept. And we don't, you talked about prevention is like, what is that? you
Yeah.
know um and so but we know prevention is better than cure. And so but it was very, even within that space, and it's changed a little bit, but it's still very much, you're looked at as a diagnosis, you're looked at as, something that is not working, something is broken. And so it's from a glass half full, a glass half empty versus glass half full perspective. And so it sounds like when you're talking about moving away from that and really having that nuanced, personalized approach,
Mhm.
it's going to require a different way of how we think,
Mhm.
as a community. So community providers, the person receiving, our society, et cetera, within that.
Exactly.
Mm. Yeah. And so what barriers do you see, you probably see many, but what barriers do you see, I guess, the most across all populations?
Yeah, I mean, I think we've been speaking to them. You know, we can certainly think about the fact that a lot of the barriers that we've already talked about in and of themselves
Yeah.
have different impacts on different groups.
Mm-hmm.
However, and the work that we do, we see that there are certain barriers that touch all groups of people. And I think that those are usually ones related to this culture change that we
Mm-hmm.
need to
Mm-hmm.
shift to. So this difficulty with recognizing that mothers have needs, that, you know, it's not just after the baby is born that we all of a sudden shift all of our attention to the baby and forget that the mother or father has needs as well.
Mm-hmm.
And I think certainly that culture of stigma and the
Yeah.
difficulty with addressing those needs is unique, or sorry, common across all groups. But
Mm-hmm.
we also see that stigma related to mental health is still there,
Yeah.
although I think it's more common to talk about going to therapy. We
Mm-hmm.
certainly
Mm-hmm.
see that medication has its own stigma. So people are misinformed oftentimes about,
Mm.
excuse me.
Okay. That's okay. Take your time.
Sorry, recovering.
That's okay. That's okay. Take your time.
We see that there's still misinformation around side effects from medication, a lot of fears that are unfounded, or there's even to go in and talk to a psychiatrist. I often see families have a lot of fear, or if a
Mm.
family member or friend were to learn that they were on medication, what would that mean?
Mm.
And that
Yeah.
is something that I see across groups still.
Mm-hmm.
But I think some of the most common barriers across all groups are the systemic and structural barriers. So
Mm.
the difficulties with lack of availability of providers, lack of trained providers, lack of funding, policies and laws that impact like insurance coverage and the way and how long people can, you know, seek care for mental health difficulties.
Mm-hmm.
And then really our system is so siloed. So in terms of the
Mm.
way that maternal health care is so separate from children's health care,
Yeah. Yeah.
and yet in the postpartum period there's so much overlap, but
Mm.
a lot of times those systems are not talking to each other,
To one
and
another.
that certainly will create a lot of barriers and have a lot of families falling through the gaps when they have mental health needs.
Yeah. Yeah. A lot of unnecessary barriers. Yes.
Mm-hmm.
We have a query from Erica, and Erica said, I love the new EPDS US screening tool, but I know a lot of providers don't screen. So I encourage people to screen themselves and then use that to start a conversation with their families and providers. And Erica shared a link. But the query is there any reason not to self-screen?
That's a great question, Erica. I also encourage families to screen themselves. One of the nice things about a lot of screening measures, including the EPDS, is that it's freely available. I think that one of the difficulties with, I mean, it's a conundrum, I think, with providing a lot of empowerment and advocacy to people that don't have a background in mental health. One of the good things with that is that they are empowered because they can go and do that screening themselves. They know whether they have scored higher than what is considered normal on that screening measure. They can share it with friends and family. They can talk to their provider about it, advocate for resources on their own behalf. And also, because they don't always have a background in mental health, sometimes not all screening measures are perfect. So sometimes certain questions are a little confusing. Sometimes certain questions are asking about one thing and they may think that it's asking about something different. And so thinking about supporting them in providing education with whatever screening resource that we're sharing with them, but also really, really encouraging them to talk to a provider about it, that it should be something that they do collaboratively with a provider. I also think about some of those screening measures that ask about suicidal ideation, which is really important to ask about. And I also wonder for a healthcare provider, we know what it means if someone endorses suicidal ideation. We know that we need to get that person help. Even if you're not a mental health provider, you know that you need to send them to somebody for safety reasons. And I think that for people who are not working with a healthcare provider, they may already know that they've been having some suicidal thoughts, but I think we need to really help encourage them to understand what to do when some of those more concerning behaviors come up that we know as healthcare providers would sort of give us a red flag, that they have a kind of a step-by-step process about what they would do. Should their score get higher, or, should their symptoms get more severe? But I totally agree with supporting parents with self-screening.
Yes. And it kind of gives that the ownership back, the autonomy back, and power back, really. But also, like you said, in collaboration. And also, it was noted that today in the chat that today is World Suicide Prevention Day, and it's also Maternal Suicide Prevention Week. So this is really a timely discussion. And there's another query that popped up, and it said, what can we do as individuals, clinicians, family advocates, peer-to-peer mentors, etc., to really address the access issues in an impactful way?
Yeah, I like that question because of an impactful way. And I just want to speak to that first, because I think that this is one of those things where we are likely to not see a large positive outcome or get that sense of gratification right away. But that doesn't mean that the work that you're not doing isn't impactful. And I think that's one of the things that for those of us in this field, we certainly recognize it's a lot of work and it's hard work. And oftentimes we still see a lot of these barriers and families falling through the gap, and it can feel really disheartening. But I don't want that to mean the same thing as our work is not impactful, because I certainly see that everyone's work is impactful. So, one of the things that I think is often underestimated, and I spoke to this before, is this idea of preventive efforts. So what we know statistically is that 100% of moms are not going to need intensive mental health services. Most, in fact, parents do not need therapy, do not need medication, do not need intensive outpatient treatment. This is actually not going to be the case, just statistically speaking. And this is more true when we engage in preventive efforts. So when we're raising awareness about postpartum depression, when we're talking about suicidal ideation, when we're talking about substance abuse, these things are leading to decreased numbers in the amount of people who go on to be on wait lists and who fall through the gaps. So I do think that things like holding campaigns, having a NICU awareness month or suicide prevention week, offering talks and trainings for family advocates and people with lived experiences, sharing your stories, listening to other people's stories, all of that is really, really important. And then another thing that I think is so valuable that takes a joint effort is partnering with institutions. So community providers or community leaders who are on the ground doing the work every day, you have such a valuable perspective and valuable skills that these large institutions really need. And I think it's also on institutions to really know that their efforts to design protocols and services and interventions are limited if they're not partnering with community providers to to disseminate those resources.
Yeah, and I think, and again, that goes back to what you talked about, the meaningful bit. And I like the fact that you said even if you don't see it immediately, doesn't mean that it's not making an impact. And to your last point about community leaders, recognizing that all of us, like you said earlier, can play a part, and it's not just the, I guess, traditional providers or healthcare workers, whatever we call them. But we all can. And so it's like empowering our society as a whole, so that when someone does say they're on medication or do say they're struggling, that there's not this, what's wrong with you? Even if it's nonverbal, that reaction to, to you. And then you just say, okay, I'm just going to clam up because no one's going to be there. So I think it is about that, all of us having a big, part in that. Yeah. So, and thank you everyone that's asking queries. Is keep them coming. It's adding so much richness to this conversation. So thank you so much. And so we talked about sort of barriers in general, and the next query we have is, what barriers do you feel are population specific, or are there barriers that are population specific?
Yeah, certainly. I mean, like I said before, a lot of the barriers that we've already talked about that touch all people of all backgrounds oftentimes impact certain groups more significantly based on other allocation of resources and other barriers that exist. So I want to speak to that first, but there are certainly additional barriers that are population specific. So I think just to highlight some of the ones that we see most prominently, certainly language access is a huge barrier. So having providers that speak your preferred language is certainly very important. I think access to interpreters is essential, and still having someone that shares a culture and a language with you also, I think, brings down a lot of barriers related to stigma and mental health and talking about difficult things related to emotions and mental health for sure. And then one of the other ones that we see a lot is related to location. So a lot of our mental health services are located in more urban areas. So we see huge gaps in service provision in rural areas where mental health needs are really high. I mean, with COVID and our increase in telehealth, that was, one of the silver linings, if you will, related to what we learned and how care improved. So a lot of telehealth is available to people who don't have in-person services available to them, yet and still we see that this is a huge gap for sure. Finances, certainly for families who have public insurance or have lower SES, we know that their quality of services, as well as how long they're able to stay in care, all of that certainly impacts their access to good quality care as long as they might need it. Some of the other barriers that we see specific to certain populations are related to racism and discrimination. I talked a little bit about that before, but we recognize that Black and Brown groups have a history of mistreatment in the healthcare realm, whether that's related to research or actual service provision. And so there is an understandable and well-earned mistrust a lot of times in the healthcare system. And so thinking about not only how we go the extra mile and think about how we create that safe space that we talked about earlier, but also recognize that there are still, unfortunately, high rates of mistreatment and discrimination in healthcare provision. And so if a family does not feel like they are safe in treatment, then they're likely to drop out, have more no-shows, again, not engage in the referrals that are given to them. And then one of the other ones that we typically see is for families who have been justice involved, if they have a fear of punishment, a fear of their child being taken away, if they have been involved with child protective services, or if a family member is undocumented, these can certainly create barriers to feeling safe in a mental health care setting as well. And then two other ones that I think are very specific that we don't necessarily think as much about, I will say, are fathers or non-birthing parents. So of course we're talking about maternal mental health today, but I certainly believe that this is a community issue, and that if a father or the non-birthing parent is not doing well themselves, or if they recognize that a mom is struggling, but they are struggling with how to support her, then that is going to exacerbate a mother's mental health as well. And so recognizing that there is a stigma for men and there is a stigma for fathers in terms of them, there's expectations that are different than there are expectations for mothers. There are expectations placed on both, but I always talk to families about the fact that there are different expectations, and certainly that is a specific barrier for men in seeking support. And then I also wanted to talk a little bit about mothers struggling with substance abuse. So this is, even within the realm of mental health, there's an additional stigma placed on mothers who struggle with substance abuse. And so not only are there judgments related to if you are a mom who's struggling with substance abuse, but also our healthcare system is not set up to support mothers or fathers who are struggling with substance abuse. There are not programs really that do both well, perinatal mental health as well as substance abuse. And then there's also this additional sort of judgment that they get from healthcare providers, from family, from friends. So certainly that will create some barriers as well.
Wow. I'm just going to sit with what you just said, because there's so much within that. And I guess one of the things that resonates really loudly is what came to my mind was invisible suffering. You know, so when you have families that have not been considered, like I said, fathers or non-birthing partners, or, just the awareness that suffering is occurring is sometimes not even there, so we can't even, so we're almost having to peel like all the way back to the core to even recognize that they exist almost. And then that what they're experiencing is real. And then the whole thing about, drug use. And I heard it said, maybe put someone on the spot here, but I heard it said last year at our retreat, and they didn't say drug abuse. It was another term that was used, and I can't remember what it was, but it was a very very positive and proactive way to, even like you talked about language, to even begin to describe people who are having different lived experiences. And I think that's really, really powerful. There was just for everyone there's a link that Erica has shared about more about pregnancy and parenting and substance use. And there's a link, perinatal harm reduction. So if anyone wants to link onto that, that would be really, really great. But just so much. We may have to get to talk to Kira, but we may have to have you for part 3. Because I think there's so much. I mean, but the whole thing about it being so nuanced and how that goes contrary to our standards of care. We're so, and yes, we are changing, but there's this is kind of the way that we do it. But not really being sensitive and mindful of the people who are receiving it. And so there's so much to unpack here. So I really thank you for sharing. So, and think about like all the things that we've discussed today, and things that you've brought up, sort of, the barriers and access, and all the sort of things we need to be mindful of as a community. What do you feel are some of the solutions? You sort of alluded to some of them before, but what are some solutions? And I guess from a layman's term, it was, if I'm a politician or if I'm a sort of decision maker in a hospital, what can I do from a community level to really tackle and address this problem in a meaningful way and beneficial way?
Yeah, I mean, in addition to what we spoke about, I think
Mhm.
that for people on the ground doing the work, for community providers, finding ways to make the work sustainable is also really
Yeah,
important because, again,
yeah.
it can feel like you're not getting anywhere when we actually, as a group, are. So,
Mhm.
certainly joining groups and organizations that are doing some of the amazing work is, I think, a big piece of how you not only stretch your network and your skill set, but know about what else is happening out there. So,
Yeah.
certainly, I encourage people to get involved in local and national organizations doing the work and the efforts. That also often helps us understand what research is being done, what innovative
Mhm.
programs are out there, really getting
Mhm.
involved in that when you have the opportunity to. There are certainly a lot of digital mental health
Mm.
platforms that are being created right now to increase access to care. So things like
Okay.
classes that you can take online as a parent,
Mm.
or
Mhm.
text message based programs, certain things that are aimed at increasing access to care. So looking into some of
Mhm.
those efforts, getting involved with that. I
Mhm.
certainly think empowering parents in whatever relationship you have with them, parent advocate, peer mentor, thinking about how to increase healthcare literacy so that they have the skills and the tools to navigate the healthcare setting, like
Mhm.
self-screening. That is a way to do
Mhm.
that.
Mhm.
So finding ways to help empower parents from that perspective, teaching them skills and self-advocating in the healthcare
Mhm.
setting. And then excuse me. And then I think for many of us who want to be doing more or who's seeing bigger efforts, sometimes getting involved in the legislative process can feel really rewarding. And so
Mm.
I encourage
Mhm.
people to look into organizations like Mental Health Leadership Alliance, as well as the Policy Center for Maternal Mental Health. It's not only a way for you to get a lot of information related to like fact sheets,
Mhm.
statistics, be staying aware of what's going on, but also they have a lot of resources that you might be able to utilize in your community, at your organizations, as
Mhm.
well as to advocate on behalf of some of the community partnerships that I spoke about before.
Mhm. Mhm. Wow, that's really, really good. And in our chat, we're trying to capture all of that you've shared, so some of these groups so that people can follow up on them. And it is something, when you talked about the community and going back to the concept of self-screening, it's that goes back to what you said earlier. The circle back around is how important it is that it's beneficial. So that was going to require, when we're talking about solutions, to actually have the people who are going to be receiving them on board,
Mhm.
being a part of that conversation, so that we're not creating something because we think it's supposed to work and it doesn't land, for whatever reason, it doesn't land with the groups that we're trying to work with. So I think it is also important about, almost part of equity is leveling that playing field and realizing that the person experiencing, having that lived experience, and also the person or group or whoever is that's trying to assist, that there's expertise in both of those.
Yeah.
And both of those need to sort of be working together, in order to come up with the solution that's most impactful, most beneficial, most rewarding.
Yeah, exactly.
Yes. Oh, thank you so much. And I guess I just with you, with all the things that we've talked about, is there anything else that you feel that we haven't covered, that you feel like we need to just really be mindful of as a community within this space?
Um, I mean, there was something that you just said that really stuck with me, and sort of my philosophy around this continuum of care throughout the
Mm,
perinatal
mhm,
period.
mhm,
A lot of the work that I try to do at my institution is creating a continuity of care so that families are not
yeah.
falling through the gaps. And yet that is long work, and it is going to take a lot of efforts and a lot of people to come together to do that. And one of the things that we can do immediately is going back to empowering parents, because when you think about the different settings that they move across throughout the perinatal period, they are the one constant. So they're going to talk to a lot of different providers. They're going to be in a lot of different settings. And while we do need to be paying attention to increasing training, increasing providers' communication skills, empathy, all of that, we certainly can be doing a lot of good by empowering parents in terms of how they talk to providers across the different settings, how they share information about their symptoms, how they ask questions, and how they seek resources. And so I just want to put an extra plug in for education and, again, preventive efforts to empower parents as they navigate this system that can have a lot of barriers to accessing.
Yeah, that is such a powerful point you just talked about, is that they are the constant. The parents are the constant. And, you know, as providers, recognizing that we're just visiting in some ways. When we just have a snapshot of, you know, those 15 minutes or 30 minutes or whatever it is, or 5 in the office or in the space, and recognizing that expertise of parents and their experiences and what has worked, what has not worked, is important. I love that. Parents are the constants. So, so I don't know if there are any other. So that's sort of the end of our formal queries. Although I could speak to you for a few more hours. But thank you so much. I was just going to pause for 1 second and just see if there's anyone else out there. Are there any other questions that people have that you want to ask Dr. Poe? Because there's so much goodness that she's been sharing with us. If not, don't worry. And there, just to also remind people that there are just loads of links that we're sharing, and we will have these on our website, on our social media sites and websites as well. So you can go back and you can access them, to use them. There's so much that you've shared with us, Dr. Poe, about the different groups and organizations that you could be a part of. So I just want to thank you so much for being with us again, for agreeing to come. We can't believe it's been way too many months since we last saw you, and you've been just a wealth of information, and just want to thank you on behalf of Kira and NPN and I for your generosity of sharing information and sharing thoughts and ideas. And I think it's really important. So the whole point of these conversations is to make sure that we have these discussions, but also that we go away with some really clear takeaways. And you've given us some very clear takeaways. We've gotten someone from LinkedIn that said, please come back. So we'll have to figure out how we're going to sort of bring you back. So thank you so much to you, Dr. Poe, and thank you to everyone who has joined us today, and for all your queries and your comments and your sharing of resources. That is so important for us, to all help one another within this space. It's such an incredibly important space. We want to be intentional in our efforts to make participating in NICU Parent Network educational offerings as simple as possible. So I want to, as we close, to just remind you about a couple of things that's coming up. Our other NICUnity offerings that are going to be on all our social media platforms, so our Facebook, our LinkedIn, Instagram, and also our YouTube, NICU Parent Network YouTube channel. But there are two things that's coming up this month that I want you to be mindful of. One is the NICUnity Connect, which is going to occur next week, so the 18th and 19th of September. If you can go to our website, the NPN's website, for more information and to register. There are just a few slots left. So we would love for you to join us for that. It's a virtual event. And our next NICUnity Health. So today was about NICUnity Belonging, and our next discussion will be about NICUnity Health. And that topic is addressing the needs of parents with full-term NICU babies. And that will occur September 26th. And again, it's sponsored by Casey. So that September 26th will be our next NICUnity talk. So with that, I want to thank you again. Thank you so much, Dr. Poe. We just really value your expertise, and thank you everyone for joining, and we will see you next time.
Thank you for having me.
Thank you. Bye.